Hello everyone. Today I'm presenting the second current event, which is about the healthcare reform. My name is Saad Abdel Jabbar, MHA 575, Current Events in Healthcare. And this is another great topic that helps us see some of the major problems with the inequalities in healthcare services, especially with the pandemic that we are going through right now. Healthcare reform is mainly a government initiative that impacts the delivery of healthcare, and it aims to improve the number of covered individuals, improving the standard of care, and reducing the cost of treatment. So let's start this presentation with a couple of points about the pandemic and whether it has been impacting healthcare in a good way to actually make us like open our eyes to many issues, and then a brief overview of what I'm going to discuss about the current event on how the COVID-19 illustrates racial differences in the healthcare system. The coronavirus pandemic brought many problems, and it opened our eyes to many lessons from which we can learn from. Although diagnosis and treatments are still improving every day, the racial minorities appear to experience less standard of care, more morbidity, and mortality rates comparing to non-minorities. While fair and equal services are embraced in healthcare, the Institute of Medicine, it now called the National Academy of Sciences, recognizes the differences related to race and ethnicity for services received, and the outcomes for patients remain in healthcare, and it will also contribute to bad outcomes in several circumstances. As the COVID-19 pandemic has changed a lot economically, many Americans have lost their jobs, which has also caused them to lose their insurance benefits. So around 30 million Americans are still uninsured or underinsured, and the reason behind this large number, according to a significant amount of the uninsured people, is underinsured people, is the cost of insurance. The majority of uninsured people are people of color with low income, where they would have worse access to treatment that may discourage them from getting better preventive services. So as a result, the National Academy of Sciences began to expand its interest in recognizing what are the causes of health disparity, defining causal factors, and planning and assessing successful strategies to minimize or remove the racial and ethnic differences from the system. So health coverage and disparities is affected by many factors, including social determinants that I will talk about in the next slide, and the contribution to improving health coverage by laws and institutions uh, such as Affordable Care Act, and some institutions like the National Academy of Science that I just talked about, and the American Heart Association. And so what can we do to avoid these disparities and improve healthcare in general? Social determinants of health is more important for our overall health status. And these include what exists in the community, like what we see here on the top right, the 40% of overall health, such as lack of education, would affect 40% of the overall health status. Uh, Job status too, family social support, income, community safety, poverty, homelessness, and food insecurity. All of these again contribute to the 40% of overall health. Uh, and moving to the left side, as we can see on the left, we see 30% of health behaviors can contribute to the overall health status, and it includes like what we do, what we eat can affect us, such as tobacco use, the diet and exercise that we do, alcohol use, sexual activity. Those factors contribute to lower health status or increase health status more than any healthcare and access to healthcare services, which stand for 20%, as we can see in the blue color, the 20%, and lastly, the 10% of the physical environment. So, according to Hayes and Dilk on the article, Understanding the Social Determinants of Health, the environment and social determinants are responsible for the outcomes for almost 90 to 80% of the community health status, comparing to health outcomes to medical care about 10 to 20%. And as we know also, the disparities in healthcare will also reduce this percentage by just being in a different race. Some people will just get really good care and others don't. But it is possible that we can do better, and if we want to improve the care for patients. So before I go into talking about each institution and the ACA law, these are the three main goals almost for all the three, which are making healthcare services sufficient, accessible, and affordable. Knowing that in several communities in the United States that African Americans have been severely impacted by the COVID-19, and this is partially due to the early disparities in access to health services for minorities. At the beginning of the COVID-19, studies demonstrated that it was hitting older people with comorbidities. The coronavirus emphasized the inequalities that African Americans face by demonstrating that African Americans are having more chronic conditions comparing to rest of the population in the United States. The Institute of Medicine, now known as the National Academy of Medicine, it was founded in 1970, and the goal or the mission for the Institute of Medicine or the National Academy of Medicine is to promote health for everyone in the United States or around the world too by encouraging research, promoting health equity, and delivering accurate, safe, and effective guidelines, as I just said, nationally and internationally. The National Academy of Medicine also have a plan which contains the six goals for healthcare system, where it all contribute to the patient health. And these include the patient safety, where the patient should be protected by avoiding any harm that might happen to the patient from the treatment, which is supposed to benefit the patient. And then the effectiveness, where it's avoiding the underuse and misuse, and provide services that is based on scientific information. Then the patient-centered, which is about providing care that is respectful and responsive to every individual patient, and depending on the patient preference, needs, and values, and ensuring that the patient values guide all the clinical decisions. And then the timely, and reducing waits and sometimes harmful delays for healthcare professionals and the patient. Then the efficient, and avoiding waste, including waste of equipment, supplies, ideas, and energy, of course. And the equitable, in providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and all the social determinants that we talked about, and so on. And the vision for the National Academy of Medicine is a healthier future for everyone. American Heart Association was founded in 1924. The mission of the American Heart Association and the support efforts is to provide a better and longer life for the population by preventing illnesses and changing the health reform to support the best needs of the patient. The American Heart Association goal for the reforming of healthcare is to make health services and patient coverage sufficient, accessible, and sustainable for all the United States residents. It also reacted to the national discourse of healthcare reform early in the beginning of the 90s. And its principles, as you can see here, include the expanding access to care coverage, increase the availability of evidence-based services, eliminating bias, and that include like race, sex, and gender, and so on. Then strengthening the public health system, promoting diversity and cultural competency within the healthcare workforce, and making investment in biomedical research a national priority. The American Heart Association is also dedicated to reducing the mortality and morbidity attributable to cardiovascular disease, stroke, and vascular risk factors, and promoting cardiovascular health. So for the last century, there was a decline in deaths due to coronary heart disease and stroke, which is among the top 10 public health achievements. Although the total deaths, the total death rates due to cardiovascular disease and stroke have tended to decrease over the last 20 years. These reductions have not been equally realized through the racial and ethnic groups, including the non-Hispanic, white, black, Asian, American Indian, Alaska Native, and Hispanic Latino. The Affordable Care Act, and sometimes it is known as ACA, or Patient Protection and Affordable Care Act, or PPACA, or Obamacare, which was signed by Barack Obama in 2010. The goal of this law is to make health insurance available and affordable to more Americans and support the innovative medical care delivery methods designed to lower the cost of healthcare generally. And some of the benefits and protection it provided include the preventive services such as the immunization for kids, mammograms, and all of these with no extra co-pays or fees. And also the young adults can stay under their parents' plan until they turn 26. The coverage for pre-existing conditions, and there are no lifetime limits on insurance coverage. So since the 2010, when this Affordable Care Act law was signed, excuse me, there was an expanded access to public health services to millions of uninsured Americans protected by Medicaid, and advent of health insurance platform and a range of patient protection schemes intended to reduce discrimination on the part of providers and in healthcare programs, and to restrict the right of insurers to refuse, limit, or cancel insurance coverage. Avoiding disparities and increasing the outcomes for patients. African Americans have been heavily impacted by the COVID-19 and mainly due to the early disparities in access to healthcare services for minorities. As in the beginning of the COVID-19, the study showed that it was hitting older people with more comorbidities. And the coronavirus actually showed the inequalities that African Americans face by showing that African Americans are having more chronic conditions comparing to the rest of the population in the United States. So, reducing the outbreak of the disease includes, as we know, the acts of isolating when someone is sick, wearing masks and washing hands, and isolating differs between wealthy and a poor family. So, for example, it is not possible for a big poor family of, for example, like more than three people who are living in a one room apartment or a studio apartment to isolate from each other, while comparing to a rich family, isolation can be done more comfortably. They can do the social distancing, and isolating in one room is actually possible and easy. So, with all what COVID-19 is causing, there are many clinics that are actually shutting down, especially in the rural areas where many of the minorities reside. These hospitals and the small clinics too should be the main focus to offer more resources and preventive equipment to reduce the infection in these populations. And now and after the pandemic, people will always need the equal and fair health services, of course. So these disparities could be avoided by these steps that we have in front of us, and it include the boosting of the public health care provider awareness of differences in race and ethnicity and treatment wise, expanding the coverage of health insurance, increasing the availability and number of physicians in communities in need like this, and especially the underserved ones too, and growing the evidence base on the factors causing disparities and strategies to reduce it. In the end, with all the bad and difficult situations and the COVID-19 created, shined a spotlight on the inequality in healthcare in the United States, and we're hoping for a better healthcare system in the future. This is a challenge that we all are facing until now, but it actually also falls heavily on the low-income African Americans. Uh, we also need a public effort that discusses the gaps and inequality beyond just access to services, and how we can improve or build more solutions for an improved healthcare system that can be equally effective and accessible for everyone. Thank you so much for listening. I tried my best to make every word clear, but I'm kinda feeling under the weather. I hope you benefit from this video, and if there is any question, please feel free to share it with me, either under the discussion post there or in the YouTube channel. Of course, all questions and recommendations or any comments are welcomed. Thank you.